Okay, so I've started the recording, so if you want to go ahead and start.
Okay, lovely. Well, welcome everybody, and thank you very much for joining us today. It's fantastic to have this group come along who are passionate and interested about food nutrition. There we go. So if I introduce myself first, my name is Sue Trott, and I've been working for the Evolve Care Group for many years. I started off as a care home manager, a registered nurse by profession, and then moved into quality assurance, and then to become the catering manager for a number of years. There were 5-6 homes in the group. So you might wonder, well, that's a bit of a strange progression, but in between times I've had 2 food businesses. One was a country restaurant and the other was a deli cafe, which I opened and ran. So I'm very interested in food and passionate about it, and I know the impact of good food and how it's prepared and shared on our residents in the care home settings. So it's always been a passion of mine, and I've been very involved in it for a number of years. And I've also benefited from some brilliant training along the way. I mean, the standard food hygiene and HACCP level 3s, but also nutrition training, some from the National Association of Care Catering, which you might know of, also Dementia Care Matters, and other more standard training from our local SALT teams, dietitians, and also some of the suppliers like Fresenius, Nutritional, Robocoop, Bid Food. There's some excellent training out there, which I'm sure some of you will have accessed. I'm also very aware that the care home teams in our localities are supporting training in many different areas, but including nutrition, including IDSI, dysphagia, that sort of thing. So this is very much designed to be in line with other offerings, but because I'm from a care home background, I've always found that the training tends to be a little bit polarized around a particular area. And what we wanted to do here was an introduction to nutrition and hydration as a whole, and what it encompasses. And we wanted to do that as part of an introduction to a wider Devon care homes chef club. So I know many of you are chefs, and some of you work in the care home environment in different roles, and you beaver away every day, and you're very experienced and very knowledgeable, but sometimes you feel a bit isolated. So I'm hoping that you'll find the peer support of the chef club is something that you can benefit from and contribute to, because this is for you, about you, and by you. So do ask questions as we go along. I'll try and explain what the plan is for the next 6 sessions, but it's very flexible, and I really want you to be involved and to feedback so that we know exactly what you want to know about, where you feel you need support, and if we're pitching it at the right level for you. So these first 6 sessions are designed not to make you expert nutritionists, but to give you an overview, really, of nutrition and what it is to be outstanding in nutrition and hydration care. So at the end of the 6 sessions, hopefully it will have given you an overview of practice, and some of you will say, well, I know all that, but hopefully it will reinforce your confidence that what you're doing is right and on the right sort of track. But going on from that, what we hope in the new year is to have slightly less frequent meetings, but maybe more specific and more in depth and more practical. Because obviously with COVID, we've all resorted to remote working, but cooking is a very practical skill. And if this is the Chef's Club, we want it to be practical and relevant to you in the kitchens. So this is the dry stuff, the dry background information, if you like, which you may or may not have had before. But going forward, we want to get more practical, more in the kitchen, and put our knowledge into practice, if you like. So do feel free to ask questions or make comments as we go along. I'm getting a bit on in years now, so interruptions will probably completely throw me. But if we've got questions and comments coming in, then we can get back to you on those as we go along. I'm not quite sure how the timing will go. Once I get started, I tend to rattle on very quickly. So if the pace isn't right, or if you can't hear me properly, please let us know. And so I'll aim not to go over time, but I would expect today we might finish a bit early. So what are we looking at today? I want to look at the course and let you know what topics we'll be looking at. I want to introduce the idea of nutrition champions, because cooks and the chefs and the kitchen teams are busy cooking away in the kitchen, but actually the whole thing of food is a whole team approach. So you do the cooking and you take the food out, but then we've also got to consider obviously our residents, where they sit and eat, who supports them, how they make their choices, and all these things. And actually, if we can engage other people in your settings to become a nutrition champion with you, then that actual rollout and that connection between the kitchen and the rest of the team becomes a lot stronger. And I think that's really valuable. We're going to look at the overriding legislation, because the care home sector is very highly regulated, as you probably know. So we'll just look at who's involved in setting our standards. I've prepared a nutritional care strategy. It's actually taken from one that the National Association of Care Catering produced. And that sort of sets a policy standard, if you like. And I know we all go, policies, put that back on the shelf. But actually, if you read through it, it's very simple, very clear, and it sort of sets your standards for your home. You might already have a nutrition policy. I hope you do in place in your homes. If you do, go away and have a look at it and see what it covers. And have a look at this one as well, which we're going to post on the website, because it kind of lays out the structure for the course. So this is what you need to have in your home as a basic, if you like. And this is what sets the standards. And then the other benefit of the policy is it sets the standards, but it gives you a document to refer back to, so that if somebody questions what you're doing, you can go back and say, well, actually, this is what we're doing and this is why we're doing it. And this is what it should be. So it is quite a useful document, and every home should have a nutritional hydration care policy in place. And then we'll finish off today with just looking at how CQC inspects and what outstanding nutrition care can look like, just to give you a reference point as to, where we want to be heading. So I hope that's all clear. So I just wanted to introduce Devon Care Homes Collaborative for those of you who've never heard of it much before. It's a membership organisation that was created by a group of Devon care homes. So it's an organisation that's run by care homes and community settings for their members. And it can access resources and funding from the wider sort of community of health and social care, and it can influence change as well. And it really came about because of COVID-19, and it's done some really valuable networking and especially around COVID-19 and infection control. And it ran a course earlier this year, which some of you might have been on, the Infection Control Champions course, which was well attended. So it sort of aims at sharing best practice, and it's very collaborative. It means especially you in the smaller care homes, you know, you don't have to be on your own anymore. You can get together with other similar people, similar chefs, and share your experiences and your concerns and your challenges, and hopefully some recipes along the way. That at the bottom, you can see the web address for the website. So this just outlines what I think I've said a little earlier about the Chef's Club. At the end of the day, good nutrition and hydration is really the foundation of good care and emotional well-being. And it not only ensures people are less likely to suffer from poor health, infections, falls, that sort of thing, but it also is absolutely essential in their emotional well-being. I think for many of us, food, our meals are the highlight of our day, and a nice cup of tea, you know, does the world good for all of us. So I think you can't underestimate the importance of your jobs in the care homes. If good food and good drink is going out to your family members or residents, and they're getting to eat and enjoy it and socialise and benefit from it, then everything's good with the world. And you can avoid so many of the problems and challenges that arise from poor nutrition and poor hydration. Just very simple things that can affect our residents, family members, you know, pressure sores, behaviours, all sorts of things are affected by what people are eating and drinking or not eating and drinking. So I know that you all come with a wealth of knowledge and experience. I really don't want to be telling you what you already know, although you will already know a lot of this. But I just want to try and draw you in and share all our knowledge and experience and see what you need to move forward and how we can help you do that. So I wanted to talk a little bit about being a champion, because although you're all champions, there's a few things to it that you might want to just have a think about. The Champion Network has been shown to work really well in making change in your settings. There have been other courses run in different things, you know, nutrition, infection control, and so on. And what it provides is a support network. If you're trying to affect change, if you as a chef in the kitchen see things that need to be improved, it's really difficult for you on your own to try and do that. And similarly for carers or nurses or even... Are you okay? So about having some champions that you can work with in your home, that will really support you in making change. So who can be a champion? What sort of person is a champion and what is their role? I mean, anybody can be a champion. You just need to be passionate about what you're doing. So I would think that it would be sensible that the chef or a member of the kitchen team is a nutrition and hydration champion, because that's where all the food comes from. But you know, in addition to that, it can be a member of the care team, clinical team, manager, house leader, activity coordinator. You can involve your residents, because what it's all about is getting together, sharing information, agreeing what you want to do and how you want to do it, and making change. So to be a champion, it can be anybody. I mean, you need the passion, but you do need to be confident enough and to have the authority in some sense to go out and spread the word. You need to listen to what people are saying about, you know, what your food and drink's like and how it's all working. You need to be motivated. You need to perhaps have some initiative. You need to be prepared to challenge if there's poor practice going on. So those are a few of the characteristics you're going to need, and using those characteristics, you know, the typical behaviours are shown here. This is a bit theoretical, sorry, but you know, a champion will find solutions to problems. They'll have empathy. They'll sort of, you know, if a resident is talking to you about the food they've been having, or choice or whatever, you know, you have to be a good listener. You have to be able to communicate, be approachable, and perhaps see things from different perspectives. So those are just a few of the behaviours there that you might need to be a successful champion. So if you introduce the champion role, what's expected of you? You're not expected to be an expert. You're not expected to know everything, but it is helpful if you know where to get help. You're not responsible for the nutrition and hydration policy in your setting unless you're the manager. The manager is responsible for making sure the policy's there and adequate training. But the great benefit of the champion is they can be a role model. They can get together and collaborate between all the different sort of team members. They can be an influencer, need to be familiar with the policies and up to date with training, and have ideas about how to share, you know, important things around food and drink in your home. And it's really important to have a good relationship, either with your, well, hopefully with your manager, but also with your carers and clinical leads. You need to find out who you can link with and work with so that you can effectively get feedback and make the right changes to have the best nutrition and hydration care. So hopefully during the course of these sessions, you will get sort of information that you can use and share, and certainly going on next year. And I think training is actually fundamental to best practice. And so we really want you to, any new material, to go back and share that with your teams. And there's lots of different ways of doing that. You know, you can do it one-to-one with somebody, you can set up a meeting or a training session. Chefs don't usually go in, I don't think, to handovers or 11 at 11 meetings, but sometimes that might be useful to develop those links with your care team and to find out actually what's happening. So you can save your material in folders, certainly your menus and that sort of thing. You might use WhatsApp, email, online and electronic care records. I don't know how many of the chefs here have access to care records. That's where everything's written down about each resident, and I always think it's a shame if there's not that link, because you can learn a lot from what the carers have found out and shared. So there's lots of different ways, essentially. There's visual ways as well, posters, blackboards, message boards, of sharing information and getting your message across. This is just a little change model, if you like. There's various ways or various models that you can find online that describe how you can get your message across, really. So we all know that if somebody stops you in the corridor and says, don't do that, do that, you're not likely to sort of be very impressed. There's lots of different ways of talking with people and seeing if you can make change. And this is one such model. It's called the SBI model, Situation, Behaviour and Impact. And I can describe it in a way that somebody described to me a training session they did in one of the homes. They wanted to highlight to staff food safety risks in the mini kitchens. So what they asked them to do was to go away for 10 minutes with their phones and take as many pictures as they could find of things that could be food safety risks in their mini kitchen. And then they all came back and reconvened and looked at the photos, and shock horror agreed on the different sort of things that they'd found that were not right. And then they agreed what they were going to do to fix those. So that really empowers staff to get involved, to find their own problems and to sort out their own solutions. So there's lots of different ways you can affect change positively. So before we sort of go on, has anyone got any burning questions so far about what I've sort of touched on? Nope. Okay, well, we'll have a chat at the end, hopefully, and get to know you all and get some feedback. So moving on, what we all love, a bit of legislation. We are very highly regulated in health and social care. If you work in hospitality, then that's quite highly regulated as well. The food hygiene legislation includes the Food Safety Act, HACCP, the allergens, and general food hygiene ratings. So the environmental health officer will come round on a regular basis and assess your kitchens. So you will have a food safety system in place. We're also governed by health and safety at work, manual handling, COSH, gas safety, water regs, infection control and prevention, COVID-19 and so on. But the different one is the Health and Social Care Act 2008, Regulation 14, Outcome 5, which looks at meeting nutritional needs. So this sets out the legislation that CQC come and inspect on to make sure that we're providing adequate food and drink. And if you've ever looked at CQC report when they've been round to your home, food and drink is looked at, inspected under one of the key lines of inquiry, effective. E3, how are people supported to drink enough and to maintain a balanced diet? There are 6, I think it is, correct me if I'm wrong, safe, caring, responsive, well-led, 5 Chloe's key lines of inquiries. We have to be safe, caring, responsive, well-led and effective. I think that's all of them in the care that we provide. And the Care Quality Commission, when they come round and inspect, they break down what they see into those different subsections, and that's what they base their inspection around. So we'll look at that in a bit more detail later. So I'm going to share with you a nutritional care strategy. I think Anne will confirm that for me when that will be available to you on the website. It's broken down into different categories, but it covers risk, so around things like dysphagia, and hopefully you're familiar with the IDSI changes to texture modification. It looks at nutritional screening. Most of you probably use the MUST tool. Some of you might use something different. We're going to have a look at fortification and what food first fortification means. We want to look at nutrition and hydration care planning. Now, that's not something the chefs normally do, but something that the care and the clinical team tend to do. But in the care planning is lots of information that's very relevant to how we cook and prepare meals, and what people's choices are and that sort of thing. And we're going to be looking at risk as well. We want to look at the mealtime experience. It will be interesting to find out how involved chefs and catering teams are with the actual mealtime experience, as well as cooking, food presentation, how we serve it. And we'll take an overview of menu planning. Menu planning is a really important process, and I expect you all do it in slightly different ways. But there are certain standards that we have to meet on menu planning, so we'll look at that. Special diets and special occasions. I'm not certain if I'm going to be able to get any dietitians along to our initial 6 sessions, but I'm certainly hoping to, after Christmas, involve the community dietitians and SALT teams, because they are your go-to contacts when you need help with your residents, and also up-to-date information as well, and they can be really helpful and useful. So things like diabetic diets, we want to look at in more detail, and also we've got a lot of other things coming through now, like gluten-free, vegan, all those lovely challenges. And then we want to look at what outstanding nutrition and hydration care actually is and how you evidence it, because you can be the best chefs in the world and putting out the very best food and drink, and your residents might love it, but you have to make sure that everybody knows about it, and that what you're doing is documented, so that, again, when everyone comes along, like CQC and environmental health, your documentation is all where it should be and how it should be. So we want to make sure that you're aware of your partners in nutrition and hydration care, who can help locally and nationally. We want to try and share resources. I'm sure you've all got some amazing things that you do for your residents. So very much the aim of the Chef Club is to be collaborative, and to share ideas so that we can all benefit. And then we want to plan ahead for the Chefs Club in the new year. So as we go along, I want to get your feedback and ideas, because I want you to be involved. You'll get bored sick of me coming up every week. So we're hoping to bring in some other speakers for you who are specialists in their fields. And then after Christmas, simply because you can't pack it in before, we want to do an overview of catering procedures and food safety. So we'll look at risk analysis and consider what people are doing about allergens and audits and that kind of thing. So that won't be till after Christmas. And in terms of nutritional care, I've just done a slide there which says, well, whose responsibility is it? Nutritional care, hydration care. Well, it's everybody really working, living and visiting the service. I don't know if you remember the scandal of, was it North Staffordshire Hospital a number of years ago, where patients were ringing up the police and pleading for help because they couldn't get a drink. You know, everything had got so bad, it was nobody's responsibility to make sure the person in the bed was comfortable, fed and watered. So it's everyone's responsibility in the home, but the responsibilities are slightly different. So it's the manager's responsibility to identify, assess and manage the risks and make sure the policies and training are in place. As champion, it would be your responsibility to be a role model for influencing best practice, to try and influence change. Be familiar with the policy so that you can support others to comply, understand and identify the challenges, and seek guidance and support from your manager. Your manager's got many balls up in the air. She's looking at the whole caboodle, everything that's going on, and it's been a really challenging time, I know, for everybody. So if she knows she's got some champions in her home specifically looking at and working on nutrition and hydration care, I mean, that will just be fantastic. But you have to work with your manager on this. It's not something you can go solo on. And I said earlier about evidence. So when your CQC inspector comes around, they will be looking for evidence to show things like meals are appropriately spaced and flexible for people's needs, how their needs and their choices are met. And so we all know about different cultures and religious needs. Things like that, how people are supported to make decisions about what they eat and drink and when and how they eat and drink, because some people might not want to come to the dining room and eat and drink, so we have to make their dining experience just as good. If they want to sit and have their meals in their room, we have to just think about how we do that. And I just wanted to show you this, because if you beaver away in the kitchen, you might have a chat occasionally to a CQC inspector when they come around, but that might just be it. But when they come and inspect, they use a lot of what they call information gathering from a variety of sources to inform their inspection. So they will look at data and information. So they'll look at the records, they'll look at charts, they'll look at your menus, they'll look at your blackboards, they'll look at your catering records, and they'll look at all that. They'll also talk to people. So they'll come in the kitchen and have a chat to the chefs or whoever's there at the time. They'll talk to the residents about, you know, do they enjoy their meals? What do they get? Do they have choice? They might talk to the relatives. They'll talk to other professionals. They'll talk to staff. So they get a lot of information by talking to people. And then obviously they observe. So they'll come and see what you're up to in the kitchen. They'll observe the dining experience. They'll walk around the home. I mean, I know it's all been a bit different this past sort of 18 months because of COVID. So they have been sort of not quite so prevalent, and also working in a slightly different way. But they'll still be gathering all this information to inform their inspections. So when you're keeping your records and when you're having discussions and when you're thinking about how you communicate what you've done, you know, keep a folder, keep a record, and then when the inspector comes, be proud and show them and share that evidence with them. Take photos. I mean, obviously, you know, you've got to make sure that that's agreed in your home as to who has their photo taken and whatever. But, you know, take photos of what you're doing so you can say, well, look, Mrs. So-and-so has a texture modified meal. This is what I did for her birthday, you know. So all these ideas you need to think about so that you can be proud of what you're doing and show it and share it with other people. And that will help your CQC. So these are just some examples from Devon care home inspections that I had kicking around. So these are some actual comments drawn from some CQC inspections from some homes that were rated outstanding in Chloe E effective food and drink. And if you look at them, it might be your home, I don't know, and you might be doing this, but this is the typical sort of feedback that CQC will be recording. So people at risk had their weight monitored regularly, and further action was taken in response to weight loss and appropriate referrals made. Where an individual is losing weight or not enjoying the menu, the chef will tailor a menu to ensure the way food is cooked to their liking. So it's about identifying what the problem is and then taking action, and then making sure you record that and that it's effective. That's all that they're looking for. And this page is more of the same. Tables had tablecloths, cruets, fresh flowers, placemats, jugs of fruit juice. Menus were on the table detailing food choices. Menus have pictorial illustrations. So all this might not be all relevant for your setting, but it kind of gives an overview of where you might want to go. You need to tweak it to suit your environment and your family members or residents. But these are the kind of things. The cook met with people after their meals to receive feedback and help develop new menus. If you're running a restaurant, you know, your customers love it if the chef comes out and chats to them after the meal, and that really is the best way of finding out if people really enjoy what you're eating and taking their comments on board. If you're running a restaurant, you have to get it right with your customers, because otherwise your restaurant closes. That's not quite the same in a care home, but if you don't get it right in a care home, then your residents might become poorly, and it might have an adverse effect on their emotions. So, you know, we want to look at that as we head through this course. So that's really the slides that I wanted to share with you today. So hopefully we can all come off mute in a minute and maybe have a chat about what we want to do and what we want to see as part of this course, because I think we've got another sort of quarter now, haven't we? So at the end of this session, we've recorded the session, and we're going to be saving the session and the PowerPoint for you, so that if you want to share it with anyone, you can, and the same for the next sessions that come up. We're also going to share the nutrition strategy with you, and I will be sending out a quiz and a feedback form. The quiz is very simple, very, very simple, and very, very short. It won't take you more than a couple of minutes, but that's really just to confirm your attendance. So if you would like a certificate at the end to confirm that you've completed this course, then if you complete and return the quizzes, then that will be a way of just assuring that. And the feedback is incredibly important. I've written the content for the sessions up to Christmas, but it's very flexible. So if you come to me with a particular sort of request, or if you come with feedback to say, well, this isn't what we want, can we have this? Then I can tweak it and change it, and hopefully it's going to be useful and relevant to all of you. What I would suggest as actions to take away, I don't want to give you sort of homework or anything. We did that quite a bit on the infection control course, and looking at other courses that have run, the feedback has been that you're all very, very busy people. You've got quite enough to do. So I don't want to give you jobs to do, but I think it's really important that you go away and you've taken the trouble to come to this session today, which is fantastic. Thank you, it's brilliant. So take the time to have a chat with your manager or your clinical lead or your care lead and say, this is what I'm doing and this is why, and this is what I hope to achieve, and get them on side, because you will need their help to sort of try and effect any changes. And then you'll need to let people know what you're doing. You know, well, who are you to say, well, I want to change that or I want to do that? you know. Well, I'm doing a course around nutrition and hydration. I'm passionate about it, and this is why. And you know, let me share this information with you so you know why we need to change this. So let people know what you're doing and get them on side. Do have a look at your policy, because anything I tell you on this course, it's not plucked from the air. It's I've been all through the latest sort of evidence and research and documentation from various sources, so it's very relevant. But you can't go home and implement something that's opposite to what your policy says. So if there's something that you're not sure about, ask please, or go back and have a chat with your manager and query it. And the other thing I would like you to do as we go along before the end, and we'll hopefully look at them on session 6, is just think of one single little project that you will do to apply what you take from this course to what you do in your setting. So, for example, like I said about the food safety exercise, where they went away and took the food safety photos and came back and learned from that. Think about something you can do. It doesn't have to take long at all. You know, a poster raising awareness, a new recipe for a fortified milkshake, you know, a new way of setting the dining tables, a new food club or residence menu meeting. Just think about something you can take away from what we do during this course, and at the final session bring along what you've done, or share with us what you plan to do, because I do want you to take away from this and actually put into practice the ideas that you have. The next session will be on dysphagia and IDSI. I'm sure most of you have had training around IDSI now, because it was implemented in 2019. But I think a lot of people still struggle with elements of that. And I think we need to be very clear about what we should be doing. And also how we identify dysphagia. I know a lot of you are from residential homes, and maybe dysphagia is not something that you come across or deal with a huge amount. But I do believe that it's very under-recognised, and it can really affect people with their eating and drinking and result in weight loss. It's one of those things that can easily get missed when we think, well, why is somebody losing weight? And it might be because they're in the early stages of struggling with their swallow. So even if you think you've not got people with dysphagia in your setting, I think it's really valuable for you to come along and find out all that you can about that. And we'll be looking at the different textures, because the chefs have had to move from certain descriptors to new descriptors, so not just the purees and the softs, but there's a really important safety message there around the textures that we produce. So that will be in 2 weeks' time, on the 14th of October, at the same time, same place, same link. So I hope you can join us then. And in the meantime, that's all I have for you today in terms of information, but it will be really good if you want to stay until 2:45 or just another 5 minutes or so and unmute yourselves, and perhaps we can have a general chat about who you are and where you're from, and why you're here, what you want to gain from the course. At the bottom of this slide, there's the website address, www.devoncarehomes.org. There's the general email address, info@devoncarehomes.co.uk. There's my email address, sue@devoncarehomes.co.uk. If you need to get in touch with us, please do so. And like I said, these sessions and policy, we're creating resources page. It won't be there, I don't think, today, but certainly I hope by the weekend, or be by next week.
Yeah, it'll probably be early. I'm thinking Tuesday because
Okay.
I have to do a little bit of learning on how to embed stuff. So
Okay, so hopefully by next week we'll have that up on, and I'll give you the information next week to make sure you know where to access all the information and resources there.
the WhatsApp for the Chefs Club is
Yes,
up.
that's what I was going to say.
I've only got 3 members so far, but it is up.
I know some of you, when you registered, agreed to sign up. So I'll share those agreements with Anne so we can join you, hopefully, to the WhatsApp group. And anybody else, let us know either on the main DCHC WhatsApp or by email if you want to join the DCHC Chefs WhatsApp group. And where we've done that before, we did that with the infection control champions and also with the DCHC members. It's really, I think people have found it really useful having that peer support. So if you've got a problem, you can post your question, or if you've got an idea, or if you just had a success, post it on the WhatsApp group, and we can all, share. And people, I think, have found that really useful. And the last thing I wanted to say before I shut up and move on is around winter contingency. I haven't really left a gap for winter contingency because there is a lot to get through. But obviously, last year we had COVID. This year we'll still have COVID. At the moment, we're having challenges around deliveries and certain foods being hard to get. So do look at what risks your home is facing and how you're going to be meeting those, especially around your food supplies, because although there doesn't seem to be major disruption, to be perfectly honest, we don't know what the supply chains, what the knock-on effect of all these things, the CO2, the fuel, the driver shortage, and then we get the bad weather, and then we get the sickness. So the next couple of months, you really need to be planning ahead in terms of your food supplies and deliveries and that sort of thing. What staff shortages, what you're going to be. I'm sure you've all done it, but just flag that up there. We're moving into the winter.
And we're hearing that there may not be enough turkeys this year.
No, I'm going to have with the beef. So,
I'm gonna stop sharing your screen a second.
yes,
so
thank you.
I can share my screen.
Yep, thank you.
Yep, that's what I want to do. You'll recognize this kind
there we
of
go.
as the Devon home screen. This is actually the administrator's screen. So it's got some extra stuff on. But where you will find the Chef's Club is under resources. And as you can see, I do have a Chef's Club page. It just doesn't have any content underneath it yet. But that's where you're going to find it, hopefully by Tuesday of next week.
Sorry, my computer's playing up. So thank you all, really thank you all for coming today, because I know how extremely busy you are and stretched, and everybody, your feet don't touch the ground from when you come in to when you go home. So I hope this is a thankful sit down. But are there any comments or requests or anything you want to ask?
We have a quiet group.
Don't be shy, guys, because you are all experts in your field, if you like. Oh, hello.
You want to say something, Gil?
Hi. We were just, our main focus for this course was to focus on the purees and, like you said, the diabetics. So we're trying to implement a big thing in the home of obviously trying to stop weight loss and things like that. But our main thing we're hoping is puree ideas and what we can do to kind of maintain some kind of weight, things like that. Is that going to be something we can that we'll be looking into?
Well, funnily enough, those are the two main priorities that I wanted to look at first. So next week we're looking at around dysphagia and why it happens, and the new textures. So are you using the IDSI descriptors? Do you know IDSI? No.
Yeah.
So what we'll do next week is I'll just show you what it's about. So again, it will be theory, but you need to know why you're doing something before you can do it, really. So we'll look at the theory behind textures and the proper descriptors and what you should be doing. And then I've got a really good video that I'm going to show you, which just introduces it in not too complicated a way.
Oh, that's great.
And then, so I can show you some resources you can use around the textures. And then the following week, we're looking at how we screen for weight loss. And for example, with weight loss, there's lots of things we can do to turn that around and turn it around quickly. So I'm going to introduce screening and the screening tools, but I know that the cooks and that, you don't do the screening. That's usually the care teams and the nurses, but you need to know about it. So you need to know what they're looking at and why and how it happens. But I'm really passionate about weight loss, because when you've got people losing weight, they get infections, they fall over, they get pressure sores. So it's absolutely vital. If you can nip it in the bud and turn it around.
That's our goal.
Yeah, we're going to be talking about fortification and how we can reverse weight loss. And it's all very sort of, oh my God, it's a lot of work and it's a lot of cost. But actually, if you can maintain your residents with adequate nutrition and hydration, they don't lose weight, so they don't get sick. So they don't have to add all the extra fortification. Do you know what I mean? So if we can nip it in the bud, turn it around and have a good maintenance, nutrition maintenance, if you like, then it just makes life an awful lot easier. So like I said, on these sessions, there's so much content. I'm not able to go into it in any great detail, but I can give you an overview, I can introduce you to it, and I can give you some resources. And after Christmas, we can come back to textures and we can come back to fortification, and we can say, right, what is everyone doing? Let's share everybody's experience and knowledge, because it's got to be something that works for you, that's easy for you to do in your kitchen and to turn out, and that your residents will appreciate and like and enjoy. And who better to share that than somebody who's already got that success, who's already doing it? Do you know what I mean? So that's where we can all benefit from.
Thank you.
Chef's Club, I think. So, yeah. Okay. Anything else? I'm not the expert, you guys all, I know a lot about a lot, but, where we're going to really gain from this is sharing our concerns and our needs and what we're doing and how we're being successful. And then we can pull in experts. Around the diabetes, I really would like to get a community dietitian in to talk to you about diabetes, because there's a lot of misconceptions around diabetic diets. And I think a lot of people find it quite challenging. So that will probably be a whole session in the new year, I expect. Yeah.
Yeah, we've got a few diabetics in our home. So that would be good for us.
Yeah, I mean, there's different levels of people living with diabetes, aren't there? And, you could have someone who's been a type 1 insulin-dependent diabetic all their life, who's been used to managing their own sugar level, managing their diet, their carbohydrates to match their blood sugar levels and that. Or you might have someone who's type 2 managed on diet alone, who eats loads of chocolate and drinks lots of beer. So there are lots of challenges around meeting the needs of diabetics. And unfortunately, I'm not going to have a lot of time to touch on that. But then if I get a lot of feedback saying help, that's somewhere where we really need a lot of help. So if you all complete your surveys, for example, then I can go forward and speak to the community dietitians. I've already got some links set up there and say, look, this is what our members say they need help with. Can you come along?
Okay, thank you.
Okay. So we're coming up to close of play, I think. Really great you all joining us today, and I hope you felt it was worth your while coming along. And do please share your comments and ideas, because I want this to be really valuable for you. And if you want to get involved and present a session or part of a session, or show us what you're doing, please also put that on your survey as well, because the more the merrier, you know, in terms of sharing best practice.
I'm out of coffee, Sue, so we have to be done.
Okay. Lovely. Well, thank you all for coming, and we'll see you in a fortnight's time, hopefully.
So there isn't one next week, it's on the 14th.
Next week.
Yes, every 2 weeks, because we realise you're very busy people, so we wanted to give you a breather.
But if you need any help in the meantime, just email us, okay? Or go on WhatsApp.
And
Thank you very much.
Is dysphagia, isn't
Thank
it?
you. Sorry?
The 14th, that's dysphagia, isn't it?
Yes, that's correct.
Yes.
Okay.
Thank you, everyone.
Thank you.
Thank you.
Bye-bye.
Bye.
Oh. Oh, thanks for comments as well. Thank you. Hello, you all right? Thanks, guys.
Thank you.
Bye.
Bye.
Bye-bye.